I don't think there should be competition in the NHS, certainly not to provide clinical services. I think we need to accept the fact that the Commonwealth Fund, independent funds have shown that the way that we traditionally have run the NHS has been the most cost-effective, highest quality way of providing healthcare in the world. Just the sheer cost of running a marketplace in the NHS so that competition can happen, so that private companies can compete, is hugely expensive, somewhere between £5 and £30 billion a year. So at the higher end of that, you are basically fixing all the NHS's problems if you just clamp down on that. I think the question isn't so much whether we can afford to carry on funding the NHS as whether we can afford not to. I mean, we see from countries elsewhere, I mean, the classic example is America where, I think 60% of personal bankruptcies are for healthcare costs, and these are people who are insured. These are middle-class people who are insured. I do question the wisdom of politicians who advocate more competition in the NHS. I mean, they're quite reluctant to do so, actually, because I think that they know it's very popular. You get the odd outlier who will pop up and call for more competition and indeed charging in the NHS, and the two tend to come from the same sources because competition is more expensive. Anyone who advocates more competition has perhaps been spun quite a good line by think tanks, often who are industry funded, and working very hard to try and say that there is some evidence that this is a better policy, when really, they've been looking for that evidence for 30 years and they haven't actually found any that competition actually works.